Another coronavirus hotspot is in southeastern Indiana in Decatur County. Questions have been coming into our newsroom for 2 weeks asking why this rural area is seeing such a high number of COVID-19 infections. Brock Turner sought to find the answer.
Decatur County has one of the state's highest per capita infection rates, and that's putting a strain on local health systems that just don't have the capacity to care for large numbers of patients. Sean Durbin works with the Decatur County Health Department. He believes the data paints an accurate picture. While it's impossible to know just how bad the outbreak is here, Durbin says it's clear this part of the state is disproportionately affected.
I can't speak to other counties. I also know that our testing rate per population has been higher than a lot of other counties. So those could be driving them up. It's hard for me to believe it's just a statistical error, but it's also hard to say until this whole thing pans out.
Data from the Indiana Department of Health shows Decatur County has one of the state's highest positive test rates and the highest death rate per 10,000 residents. While the lower population certainly disproportionately affects those numbers, it's still a cause for concern. Surrounding counties, while not as bad as Decatur, still have infection rates higher than other parts of the state. Public health officials have worked to use contact tracing and identify events and places that could have contributed to the spread of disease. They say large events that took place before social distancing guidelines were in place contributed to the spread here.
We definitely can trace some of the cases back to the sectional basketball game and to the Emmaus walk that was held at the Baptist Church.
Public health officials in other counties say examples like these confirm the disease was spreading in communities well before guidelines were made public and before coronavirus dominated news cycles. Cliff Bunch is the senior pastor at First Baptist Church in Greensburg. He says his church made the best decisions possible, given the available information.
I think the country has a little bit stronger picture of this, even though we don't agree on everything. It's a stronger picture of this than we did even a month ago. And so it probably would be a little bit different. It's just hard to imagine how.
Earlier this week, he and other church leaders met to discuss how to better serve the community and their congregations during a pandemic. Bunch says guidelines are constantly evolving, which is both good and bad.
Trying to keep up with the knowledge base and talk to key people in a community to help us be informed of how we can best serve and get back on track when we can.
Currently, Bunch, like many religious leaders across the country, is posting sermons online. The pandemic has pushed groups that would usually meet in person to the internet. However, he says it has led to new types of engagement. And there are other positives here as well. After weeks of being one of the state's hardest hit areas, officials are cautiously optimistic. Arthur Alunde is an internist in Decatur County. He says other indicators point to a flattening of the curve.
Overall, right now, numbers are getting better. Visits to the emergency room are decreasing. People being admitted are also decreasing.
Bunch says he'll wait for additional guidelines from the state and federal government. But in the meantime, he and his congregation will continue to do what they can to help. Each Friday, they serve meals to around 70 local residents, even delivering some to shut-ins. While the pandemic has and will continue to test individuals and resources, Bunch and others here believe there is a place for both hope and progress. For Indiana Newsdesk, I'm Brock Turner.